Dr. Jessica Drummond, honey, how are you doing today? It's so wonderful having you back.
Hi there. Thanks so much. I'm thrilled to be here. It's always so fun to have these conversations.
Well, a lot has changed even since we've talked last in your own personal journey. Often when you're coming on to the show, we've been talking about
Mhm.
endometriosis and just the diagnosis of that process, what are viable treatments, how can women tend to their bodies after the fact. But I know that you and we've had some big journeys since the last time we've really dove into endometriosis. And we're going to be speaking a little bit into that today, particularly around hormone replacement therapy. But
Mhm.
I wanted you to just start with your journey. I was telling you that one of my dear friends who lives here has long COVID, and due to long COVID, she was thrusted, like basically shot put into late perimenopause, and along with so many other intense symptoms. But it was like she was good, and then she was in late peri. I mean, she is knocking on menopause's door right now, and she just feels like someone just knocked the sails out of her, just knocked her out. So I'm curious because I'd love to hear a little bit about your journey and if this is something that you are seeing with the women in your community.
Absolutely. So, yes, that's a very, very common story. I did a very extensive lecture at the American Physical Therapy Association meeting earlier this year in February in Boston, because to our pelvic rehab specialists in particular, because COVID is absolutely dysregulating people's menstrual cycles, fertility, and menopause, perimenopause experiences. And we have some data to the effect that data of kind of large studies just shows that either COVID or COVID vaccine can kind of delay cycles for a few months, but it doesn't on a large scale tend to be picking up these cases that I have seen quite a bit in my practice of people having really dramatic transitions into perimenopause and menopause. It hasn't been studied that granularly, like everything in women's health,
Right. Let's be
unfortunately.
honest.
So, and it really hasn't been studied directly, on a large scale in the perimenopausal population. But first of all, the people who are most at risk for long COVID are perimenopausal women. So women in the mid 30s to late 40s, or mid 30s to late mid 50s.
I know it's such a big transition just to like put the 35 to 55. You're
Yeah.
somewhere you're gonna land in there.
Exactly. So for women in their 40s, roughly,
For
but
sure.
it could
Yeah.
extend, a little younger and a little older, are most at risk for long COVID. And they're most at risk with each additional infection. It goes from about a 10% risk per infection up to a 40% risk per infection when you're like 3 infections in, because COVID itself dysregulates the immune system. So circling back to a rapid transition into perimenopause and menopause, that was also my personal experience. So I got COVID in 2020, December, early on, no vaccination. We were doing all of the kind of mitigation strategies. I wasn't concerned really, knowing that viral infections, we have a lot of tools in functional nutrition to mitigate the impacts of viral infections. And we were doing all those things at home. We were also isolating and being very mindful. Like most of us are like getting it from our kids. I had the same experience. So my kids were not in school at the time, but I had a teenager, and socially I felt it was really important that she had a group of friends to hang out with. And when one of them got it, they all did. My first experience of COVID was much rougher than I expected, because I was a 44-year-old woman, super healthy. I would say I was in early perimenopause. I had had some irregular cycles. I was starting to occasionally get hot flashes, but I was working out 4 or 5 days a week. I was doing high intensity interval training. I was lifting weights, and I had been doing that. I'd been exercising my entire life. So it was nothing new. I was eating a low carb, paleo-ish diet is sort of how I generally live, between paleo and Mediterranean. So very healthy diet, a lot of organic foods, a lot of locally grown foods. I was very healthy, and I was right on top of it. And I still had months and months of very low oxygen saturation. I had pericarditis. I couldn't stand in the shower. I couldn't walk down the street had lot of intense vascular pain. In fact, I told the nurse practitioner when I went in to see her, I was like, I think there's something wrong with my vessels. So because my initial training is in physical therapy, where we sort of develop a little bit of x-ray vision with our hands with the number of cadavers I've dissected in my training. And she was like, no, this is a respiratory disease. And I was like, but of course, about 18 months later, Harvard released a review that it's a vascular injury. And we now know that COVID injures, I think of it more like an injury than an illness, because COVID injures, and we see this happening for years beyond even a mild COVID infection, organ you could consider, including the ovaries, including the brain, including the heart, including the vascular system, including the kidneys, the liver. So we're now seeing more and more of these kind of secondary sequelae. But that happened for me, pretty intense stress. I was only very temporarily hospitalized in the ER for, one or two nights because, it was so busy then. It wasn't like you were going to be inpatient as long as you could breathe a little.
Right. And then they send you back out.
They send you back out.
Yeah, they're like, good luck.
They're like, yeah, okay, here's a little IV fluid, and can you breathe? And how's your chest x-ray? All right, you're still alive, go home. So it was rough. And that was a very intense experience. And I did have some initial cardiac treatment, which was really valuable. And so initially I wasn't really super concerned about my period. First of all, I had two teenagers, or a teenager and like a 10-year-old at the time. And so I wasn't like trying to get pregnant again. But in my practice since then, I have worked with women in their early 40s who were quickly transitioned into late perimenopause to menopause, who are hoping to still get pregnant. So in those cases, I have found some benefit from, and this is a little bit, we don't have any data to support this. It's a little bit of an outside of the box perspective, but essentially not anti-aging, but like longevity strategies. I'm using things like peptide bioregulators, things that support telomere length, things that support improving the physiologic aging process and trying to sort of slowly reverse the aging process of the hypothalamic pituitary adrenal axis and thyroid and ovaries. And I've actually had some success. Now, I didn't ever get my cycle back. I really rapidly went into menopause at 46, 47, something like that. Again, I wasn't super tracking. I was just trying to like walk down the street and shower and heal my heart.
Yeah, survive.
Survive.
And be a mom.
Right. And be a mom and run a company.
Yeah.
Survive. It was a big juggling experience. So like your friend, while it wasn't priority for me, later when things were more stable, I have been implementing things to just really help my hormonal health, because I wanted to make sure that now my menopause transition, my periods stopped. I got them back once, like with some of this effort, but it really stopped somewhere in 2021. And I just turned 50 a couple of months ago. And so now I've been able to, I also couldn't about a year ago. And this is one of the challenges in terms of perimenopause and long COVID. I talk about long COVID as about 9 or 10 buckets because it can present in wildly different ways. One of the post-viral syndromes, including Epstein-Barr virus, ME/CFS, and otherwise known as chronic fatigue syndrome, fibromyalgia, a lot of these sort of bucket diagnoses, chronic Lyme, probably all have some roots in persistent virus. We're even seeing this in the data of MS, multiple sclerosis. It's my opinion that there's a probable challenge to the immune system with a lot of quote unquote autoimmune diseases. Are they really autoimmune? Is the immune system actually quote unquote accidentally attacking the healthy tissue? Or is it really attacking hidden viral reservoirs or bacterial infectious reservoirs, such as in Lyme? And it may be both. That's where the research right now is in long COVID. We do know that there's T cell suppression similar to an HIV, which is why you just don't want to keep getting COVID again and again. COVID mitigation strategies are still really important, but the immune system is dysregulated and it's functioning incorrectly in a lot of cases, but it probably is because it's also trying to do its job. We know that viral reservoirs are in COVID patients for at least 2 years is what we've talked about, is what's been studied and what's been published even a year and a half ago. And a recent study that I was telling you about before showed that in autopsies, when the bone of the skull was sawed, they were able to get replicating live virus out of this. So, which is very unusual for a virus to be able to do that. The other thing that's very unusual about COVID is it can infect the bacteria of the gut microbiome, which is also a very rare thing. So it can live in the gut for a really long time. It can live in the brain, it can live in the ovaries, and it can live in essentially any organ. So having these viral reservoirs, I think, is one of the key drivers for this sort of persistent immune dysregulation. So, and one of the challenges with that is it often exacerbates or incites. It's hard to tell because some of my patients have already had this challenge before they had COVID. And this is very common with endometriosis, but they have histamine issues or mast cell activation syndrome. I call this sort of the terrible triplet, the new terrible triplets. So in endometriosis, we used to have the old terrible triplets, which was endometriosis, painful bladder syndrome, vulvodynia, tend to coexist. That's still true.
Absolutely.
Also, we now have the new terrible triplets, which endometriosis and other autoimmune diseases also now tend to come with some kind of mast cell activation, even if it's not like a clear diagnosis of MCAS, some kind of histamine dysregulation, some kind of dysautonomia, even if it's not 100% in the category of POTS or postural orthostatic tachycardia syndrome, and hypermobility. And so it could be all the way to the level of Ehlers-Danlos syndrome, or it could be more mild. And I think what's happening in long COVID and why we're seeing it so commonly in women of their 50s is a lot of women in their 50s have pre-existing two things. The one common blood marker, I've given a ton of my blood to Yale University Hospital. And the only thing they've found consistently, not just in my blood, but in a lot of patients' bloods of what they've looked so far, is low cortisol. So how many women in their 50s are on the edge of burnout, even if they feel fine, which is what I did. But look, I was raising 2 teenagers. I was running a business. I was exercising.
Many don't feel fine, like it's very obvious.
Absolutely. And many of us do not feel fine in our 40s. Plus, especially if you're in the throes of perimenopause, that's
I mean, I tell people like your stress resilience just flutters out the door. Doesn't ask permission. She just leaves. Just fun.
Right. And overlap that, which again is something I fortunately didn't have. But if you have a thyroid issue, that could be make it even worse. Yeah, exactly. It wasn't my story, but a lot of my clients' stories.
Yeah.
So,
and then decline hormones like progesterone just gone. Yeah. And then you've got a viral infection that just kind of sloughs it all up.
Yeah. And doesn't necessarily go away because we didn't have effective enough antivirals in most cases. Now, people were trying certain antivirals that did help in some cases, quite frankly, whether or not they were sort of allowed. That was sort of helpful. I do think there's a subset of the population who either just has a resilient enough immune system to clear the virus quickly. It doesn't tend to generally fall in women between 40 and 49, but those people are there. And there is a place for certain specific antivirals. We know like PCL3 enzyme inhibitors, which is now what Paxlovid is. Ivermectin has the same mechanism, but at a much, much lower potency. There were some supplements kind of in between, but those are a little bit hard to get now. So I'm looking for kind of what other good antivirals are on the horizon. But again, COVID also triggers other viral activations or bacterial activation. So again, Epstein-Barr, cytomegalovirus, Lyme. And so these co-infections are also a bit of a problem in terms of consistently stirring up the immune system. So the problem then is you have a woman in her 50s who had endometriosis or some other autoimmune disease
like Hashimoto's thyroiditis or lupus or something.
Celiac disease, Sjogren's, something. I've seen a lot of arthritis, something like autoimmune arthritis. Yeah. So to this COVID exposure and perimenopause, which again, these things are happening at the same time. Sometimes it's actually not even long COVID. It is perimenopause, but often it's both. And so let's say you were 44, like I was, or I was 46, 40, whatever. Yeah. When you got COVID. And prior to that, you had endo or another autoimmune disease, and you had those terrible triplets, right? MCAS, dysautonomia, hypermobility. But it was pretty mild, pretty well controlled. I'm actually starting to realize I probably have had hypermobility my whole life, but not severely.
Not
And
enough
I've
to like it flag you, you know.
yeah,
Yeah.
and I was always a strength trainer. So I was very stable until I got sick enough that I couldn't exercise for long enough. And then it started to show itself. And so I think that's another thing that we're seeing in this sort of perfect storm, pyroviral loads. And the problem with COVID is it's not gone at all. We've just started to ignore it, which is allowing it to mutate really rapidly, spread really rapidly, always be around. We're probably going to forever have at least 2 peaks a year during like the summer travel season and the holiday travel season where COVID is just uncontrolled until we have either better medications or we try to do something. But I think it's going to have to come down to better medications. And that's going to, and it could actually be worse than that because COVID is so highly transmissible. We're right in the middle of this summer wave now.
I was telling you that we're heading literally after this interview, we're leaving. My sister's in surgery right now. I'm hopefully out of surgery. I was telling you the hospital was beyond capacity. Like, thank goodness she went in early, like at the very earliest in the morning, but they were beyond capacity because of COVID patients. And I was shocked. I was shocked. Yeah. I had no idea. And, you know, it really gives me pause whether we're going to go to the hospital or not, you know, because hopefully she's getting released today. So maybe we'll just wait till she gets to the house. It's been such a fascinating journey having a young child, a toddler preschooler, where we have, I mean, I think been even into early June, there was a virus. So we're almost through July. Right? We're great. July. We'll see. I don't know. I mean, maybe we'll get through August before September starts and it starts all over again. But we've been hit. We've been hit with a norovirus. We've been hit with the flu. I mean, everything has come through my house. It's just like, don't stop, won't stop. And at one point in December, we've just been hit. And Jessica, I'm not testing for COVID every time. You know what I'm not. Right. Sure. We have all the tools. I cannot tell you how many homeopaths, all the things, everything you can possibly, we have it all. And I am ready. I am at the ready, like at all times at this point. And I had no idea that illness and viruses were going to come through my door. This many, you know, on 12 average, 11 average a year. And in Peri, so I remember last year I had extreme, like bone crushing fatigue. And yes, I had a brain injury in the summer, and maybe there was a little bit of that. Definitely hypothyroidism, perimenopause, absolutely, all of it. And we were getting hit by these viruses. Some of them may have easily been COVID. I don't know. And I remember at the end of December, I went in to get everything ran because I was like, something is very wrong. I can't identify wrong. And they didn't test me for COVID, but I wanted inflammatory markers. I wanted the whole nine. I just wanted to know, like, am I dealing with a level are my antibodies up? Like, what is happening? And honestly, nothing. I remember my doctor saying, you know what, you've been dealing with this stuff for so long now. Like, she was like, you need to figure this out. Like, I was like, well, you ain't doing nothing for me. Can you just run the labs?
She's like, go home and figure this out. I don't know what to do.
And she was like, are you really in my office right now with this? And I was like, run the freaking labs. Just, you know, and so I was like, it had to have been this massive, I felt in my heart, it was a viral activation that just ratcheted up everything else I was dealing with. I just couldn't pinpoint the virus.
Yeah. And you may not be able to, because what we're seeing is it's not always COVID, but the problem is anytime you've had a COVID infection, it makes your immune system less strong. So I think of each COVID infection as more like a car wreck than the cold, because you have to fully heal from it. In some cases, for some people, that car wreck is more like a little fender bender. You're sore a week and you really do recover. Your immune system can bounce back. But by and large, it takes a few months. And then if you're exposed to other things, I mean, we used to only get the flu average, so this means even people who are more immune compromised, once every decade.
Right.
I had like a 24-year-old client. We actually did her case on our podcast, the Integrative Women's Health podcast. She has had the flu twice in 1 year. And, pre-COVID, she was perfectly healthy. So COVID is suppressing our immune systems, not as severely, of course, as HIV. But the problem is we're now getting, people could be getting COVID 2-3 times a year. And there's just not enough time to fully recover in between, even for those of us who have a lot of tools. And look, a lot of people don't have a lot of tools and don't have a lot of time to rest and recover. So if you are in perimenopause, I think it's a very important time to practice your COVID mitigation strategies, because the other problem is if you have COVID related or endo related or autoimmune related mast cell activation syndrome, it becomes more difficult for you to tolerate estrogen medical hormone therapies, which are really helpful in a lot of other ways. They're helpful for bones, they're helpful for brains, they're helpful for
Heart,
cardiovascular
punctures. Yeah. Helpful for general urinary syndrome. We're talking about pelvic pain.
Yeah. But estrogen promotes mast cell degranulation, which is why sometimes people have mast cell flares around ovulation, things like that, histamine flares. And it can be difficult for people to tolerate those hormone therapies if they're also dealing with long COVID until we stabilize that. So the good news is, in the 4 years that I've been doing this work, both on myself and with my clients, we do have more tools for managing the dysautonomia, managing the mast cell activation syndrome, managing the mitochondrial dysfunction, which is a part of the fatigue. Another piece of the fatigue is probably a hypoxia reperfusion syndrome. So if somebody has a heart attack, they don't tend to die from the hypoxic moment. They die from when the heart is trying to recover, like a too quick reperfusion of blood and oxygen, which triggers an inflammatory cascade. This is one theory, and some of the evidence does support this, of why people have that severe fatigue. And it's maybe one of the things you were experiencing. We call it post-exertional malaise or post-exertional symptom exacerbation. It doesn't feel like, hey, I'm a little tired. It feels like, hey, I just got like whacked.
As a mom that was trying to do epic Christmas, there was no room for me crawling on the floor. It was like, this ain't it.
No. And so we want to support the mitochondria, but we don't want to overstimulate, stimulate. We have to kind of support it in recovery as well, too. A couple of key tools that are really valuable for that. So sort of there's like the morning stuff you do to kind of get the mitochondria awake. Instead of caffeine, ideally, would be things like some antioxidants, some of the mitochondrial support amino acids. And then in the evening or after more activity, and I include things like putting up the Christmas tree as activity. It doesn't have to be like workout at the gym down the street. Then you want to do in the evening, you're resting, you're recovering. You are adding some PQQ, about 20 to 40 milligrams per day. Hydrogen water may be helpful. What was one of the other things? Oh, and I also like some of the neurologic supportive tools, things like bee pollen. And there are a couple of similar Chinese herbs that have a similar effect, because it's not just a fatigue physically of like a workout fatigue kind of thing. It's nothing like that. It's also a cognitive fatigue and sort of a feeling of almost like nausea, and you're overwhelmed. Like you said, you're literally kind of like crawling on the ground. And sleep does not always get you the recovery that you would hope. But you do in that moment need a lot of sleep. And the other thing that I found is really helpful, and there is some good research on it now, is hyperbaric oxygen therapy.
Yes.
Because it's another way.
But that's how I think that's when when you're in trouble, is when you're clocking the sleep and it's not touching it.
Right.
You're like, this is the thing that's supposed to really, I'm being diligent and it's not touching this. Yeah. That's when you kind of know you're in trouble.
It's so true. So I think that's where all of this really intersects in perimenopause, because so many women don't show up to perimenopause in a robust, physical health.
I always say we're very rarely coming in with a clean slate, or unscathed. we've been battling it out for decades now, and now we're stepping into this transition.
Yeah. And then even if you do, quite frankly, COVID can be a car crash. I mean, a big car crash. So, and so can other things too, right? I mean, anything that puts a lot of stress on the system, but this virus is just one of the most common things that's available now to do that to us. And so we are seeing more and more activation of endometriosis in perimenopause as well. So for women who may have had it expressed, so endometriosis is at its core at least partially a genetic disease. So there are some genetic vulnerabilities that incite endo, but not everyone with those genetics will express endometriosis. So I have a client right now, she has a twin sister, and her twin sister does not have endometriosis. She does. So that is possible, but for many women who do express endometriosis, it's also this combination of an autoimmune and a chronic inflammatory condition. And so there's a lot of question mark about women with endometriosis use medical hormone therapies or even things like maca. And that's a very individual question, as we were talking about before, because we have crap research for women's health. We do not have a randomized controlled trial that says like women with endometriosis can or cannot use estrogen hormone therapies. In my experience and in our practice, I do collaborate with a prescribing nurse practitioner, do often get our clients really healthy as we can from like an immune standpoint, an autonomic nervous system standpoint,
Metabolic standpoint.
and then they very often can't, especially if they've also had excision surgery to take the endometriosis lesions out. We know from a study back in 2018 in Belgium that not all endometriosis lesions are driven by estrogen. So this was the fear, right? It's sort of like estrogen positive breast cancers, that if you add estrogen to the fire, you're going to fuel breast cancers. And, you know, there is some small increased risk of breast cancer with medical hormone therapies, but it's much smaller than it was originally thought.
Right. A lot of women actually, you know, they have longer mortality rate and higher quality of life, you know, post breast cancer with hormone replacement therapy. I mean, it's very individualized as well for women
post breast cancer. Yeah.
Yeah,
absolutely. So I think that's the same kind of conversation. You need to have a really well-informed conversation with your doctor, because post breast cancer is not an automatic. You can never take estrogen hormone therapy. In fact, it may be of benefit for you. And because you also have to take the whole woman, not just her estrogen, not just her breast cancer, not just her endometriosis, but what else is going on? How is her brain health? How is her cognitive health? How is her bones? Yeah. So someone with endometriosis, they may have lesions that have upregulated estrogen receptors. So more estrogen for them may actually advance their endometriosis, make it more proliferative, may increase their symptoms, but not all lesions have estrogen receptors. About a fourth do. A fourth have upregulated progesterone receptors, so they may not tolerate progesterone well. A fourth have both upregulated, and a fourth have neither upregulated. Plus, the endo lesions themselves can generate their own source of estrogen. So, first of all, if it's appropriate, one of the first things I would do in perimenopause with suspected endometriosis, strongly consider a skilled excision surgery in context, right? We want to be preparing for that surgery, recovering from that surgery, doing all the things we do in our nutrition practice, using pelvic physical therapy. So don't just have surgery in a vacuum, but a surgery is often a very valuable piece of the puzzle. Then adding hormones to support the perimenopause to menopause transition could be super, super beneficial for women with endometriosis. Additionally, women with endometriosis who have these other risk factors, right? Who maybe have cognitive decline risk or early signs, even mild cognitive impairment in our 40s can lead to early stage dementia by the time you're 60.
Yeah. I mean,
this is not 20 years.
Yeah. Two things that we're noting now in peri: one, bone loss
Mhm.
It starts in our 40s. We're told to be looking at this later, but this is where it starts with, with increased muscle loss as well. And in neurodegenerate, we start to see an increase in neuroinflammation in our 40s, again, not being identified often until we're in our 60s.
Exactly. So, it's not just about the endometriosis. What else could be going on for this
Absolutely.
client, and what else could we do? So, supporting estrogen can be really preventive. And so I'm a big proponent of that. And progesterone can be really supportive for sleep, also supportive for brain health. So I think we take that in context. And then we do, again, all the other things, right? We optimize metabolic health. And women with endometriosis have lower levels of GLP-1, which is a peptide. It's a hot topic right now because there are GLP-1 agonists which promote weight loss. These peptides are highly anti-inflammatory. So it makes sense that someone has a chronic inflammatory condition on average has lower levels of GLP-1. GLP is kind of like insulin, right? It's a peptide that the body creates. And it's not that it's creating no GLP-1, but it's creating lower levels. So I have seen some benefit in using probiotics to support GLP-1 levels, and potentially also using low doses of compounded GLP-1s that are well monitored for women with endometriosis, especially when they're also doing other things to preserve muscle strengthening and growth. I think that could be because we're seeing really, really good symptom improvements in people adding GLP-1s at low doses for endo.
I was, because my brain injury, one of the things we were trying to quell, besides all the other frame strategies I was using, including hyperbaric oxygen, we decided we would try. I was on high dose progesterone. I was on a concussion protocol. I was all the things. I was in brain retraining programs, but we did microdose GLP-1 compounded peptides for just reducing inflammation, neuroinflammation in the brain, and for a good 90 days. And it was game changing for me. And so, when it came to saving my brain, I was like, I'll do anything. Like, I'm too young to lose this.
Yeah, absolutely. Quite honestly, these cognitive challenges, certainly the pain of endometriosis is key. The perimenopausal just overwhelm and mood issues and, weight loss resistance. There's a lot of symptoms that go on with both of these. Well, one is a condition, one is a transition. But I think women care a lot about the cognitive and brain related symptoms. And they don't really know where to put that because that's not as talked about as much. They don't really recognize always that it could be perimenopause, that it could be related to your endometriosis or other autoimmune disease, and that we do have all these tools to support it. Because women, one of our graduates actually is working with the British Standards Organization, and they just published in the UK national and global standard for supporting women in menopause in the workplace. Her name is Pamela Wendell, and her work is so important because I think what's happening is women in their late 40s, 50s are like, forget it, I'm retiring, because they just feel like they cannot work. Yeah.
It's so scary. There was a good chunk of last year, particularly because of the trauma, that I could actually interview you. I couldn't interview people. I couldn't write a solo episode. And when I started coming back online for these things, what used to be 5 interviews a day, whether I was getting interviewed or I was interviewing someone, no problem. Didn't matter. And then I went down to only 1 or 2 a day because I didn't know who was going to show up to that interview, if my brain was even going to work. But it had an impact on everything, every part of my life. And the one part that I hoped it didn't really impact was me being a mom. But like work wise, I was like, oh my gosh, I totally get why women are stepping out of the workforce or so afraid they're not getting promoted or just afraid to not do their job, to do the presentation, because they're afraid they're not going to remember what they're supposed to say. How scary that is. And in a lot of surveys coming out right now, particularly in the perimenopause, menopause transition, I think a majority of the symptoms are brain derived, from a lack of stress resilience to changes, irritability, brain fog, world recall, lack of focus and alertness. All of this is brain. We're talking about these ovaries, but what about the brain and how it's impacting? And also just we were talking about mental energy. I think a lot of women think fatigue, it's the mental fatigue. that they're experiencing, not like you said, the physical, like the big workout kind of fatigue. I think with our brains working so much and tethering between so many balls in the air, it's that lack of mental fatigue or mental energy that we are really worried about and experiencing.
Absolutely. You know, suicide rates of women in their 40s are the highest age group of suicide risk for women, but that improves quite a bit if we support them hormonally and with neuroinflammatory strategies. You know, so it's not just about therapy. It's about, well, and I'm all for therapy,
Me
but it's
too.
also,
Yes,
yes,
all the
and.
things.
But it's also really about the health of the brain and nervous system. It's just so fascinating that we've really taken the brain kind of out of the body when it comes to healthcare. But, you know, pain is a trauma response. And, you know, these things cannot be separated. Your brain health is just as dependent on estrogen as your ovarian health.
I agree. And if not more, you know,
Yeah.
because that's the thing, I mean, that we're so anchored to, particularly in this time in our lives. I would argue that we are the busiest, we are handling the most. I have many interviews today. Right after we finish, we are racing to go take care of my sister. And this is what's happening in midlife. This is what it looks like, you know, and that's a lot of things to juggle, like, and packing my child to go.
Well, and you're a prime example of someone who's like postpartum and perimenopausal, right? Because women are having kids in their 40s, which has always happened. But as you said, like there's a lot going on in that same time frame too. And for those of us, I had my kids more in my 30s, but you know, so now they're teenagers, which maybe I don't have to pack their stuff, but there's still a lot of cognitive challenges that come along with raising teenagers and young adults at the same time as, you know, you're caregiving for aging parents. So it's a very busy time. So I think how we always approach perimenopause and complex illness, which is really what our practice's subspecialty is. We work with women in this transition. Most of them come to us with other complex chronic illnesses, endo, long COVID, other post-viral syndromes. And the reality is that first we have to get clear what this client's actual vision of health is, because for every woman in this stage, they can be in wildly different places. Some have partners, some are single parents, some have children, some don't, some are career prioritized, some are, you know, childbearing prioritized, some have real fertility desires. And so I think because this is a really busy stage, but it's also a highly variable stage, when we help women get clear on what their health goals are, it's so much easier to target. The good news is that we have all these tools now. We do know a lot more about medical hormone therapy. We have GLP-1 agonists. We have tons of anti-inflammatory strategies. We have immune supportive strategies. We have gut health strategies, but they're challenging to use because they do require resources and time and consistency. And it doesn't mean we always need a backpack full of supplements. Like a lot of times, there are many things we can do by just changing priorities, how women are spending their time, what kind of support networks they have, because stress and even number of hours away from our phones can really add up to powerful healing, because the body has a lot of capacity to heal, but it has very little space to heal in our modern stressors.
I'd love to ask, kind of as we're finishing up, because you know that's a lot, and I know it's a lot. I've done all of it, so I know what it's like to have the consistent protocol, the supplement protocols, and the lifestyle protocols, and yeah, it requires just running the labs consistently across, you know, seeing improvement over time. It is, and then life. You know, life's happening all at the same time too, and so even in your own journey, and I know that you and I are both luckily very resourced, thank goodness. But what has been some non-negotiable in the perimenopause, menopause transition as a woman who, again, is recovering from long COVID, you know, or chronic, like you said, injury more so than anything? What have been some of the non-negotiable, and a mom and a woman who runs multiple businesses? Let's just
Yeah.
and a
Yeah.
woman who's got, you have a partner,
Yeah.
so that there's another, maybe potentially child to tend to. I don't know.
Yeah. Luckily my partner is helpful, but yeah, that could be.
What are those non-negotiables for you? Like, what are the things that every day they are a part of your, and I get that every one of us is different because you definitely have different goals than the next woman.
Sure. So one thing I decided to do in around mid 2021 is I was like, look, I do have resources and access to all these people who know a lot. I knew I had been by then involved with the Yale Long COVID Clinic, which is doing a lot of great research and doing their best, but they only can follow certain guidelines. Their hands are very tied. And that's the same for all large international or large university hospital kinds of long COVID clinics. There's really only so much they can do. But I know a lot of people as you do, and I have access to things. And so I decided I would become a guinea pig and like do all of it. Like I literally went to the Cayman Islands and had a stem cell infusion, which was, I think, probably saved my lungs from really bad downward spiral, but it was extremely painful. It was very expensive. It wouldn't be my first choice tool these days. And I've done a lot of other things, lots and lots of, hospital grade hyperbaric. I've taken every supplement that exists. We look like a pharmacy in this home, and many of the medications. So, and what I've come down to, I think all of it some of it hasn't been super helpful, but in general, all of it has moved the needle slowly but surely. And we've learned a lot. And what it comes down to is that the bottom line thing for healing, when you also have to keep running all of the stuff, or you decide to keep running all of the stuff, there was a point probably 2 years ago where I said, you know what, it's time to just move to a farm in Vermont and meditate for a year. You know what I mean? But I couldn't, not because of my work, but because I had an 12-year-old daughter. And she had already been so rocked and traumatized by the fact that her mom went from being super capable and healthy to like almost dead in 2 weeks. It was very traumatic. That whole experience was, and, on top of all the pandemic school changes and everything else. So for her, I decided that I would generally keep functioning the best that I could in a way that would feel very familiar for her. We are slowly in the background doing some things to quiet our lives. And I think that's going to be valuable, but I couldn't do it on a dime for the sake of her. So what I did do was absolutely non-negotiable. I'm in my bed at 9:30. And I prioritize my sleep like nothing else. I do not have an alarm. I sleep as long as my body needs to. I generally don't start working till 9 or 10 a.m. Every once in a while I'll have an early meeting and I'll tell my kids, like, get me up by 7. But I do not wake up to an alarm. I sleep as much as my body needs every night. I also start my day outdoors, just for sometimes 10 minutes. Don't look at my phone at first. And I have an adrenal cocktail first thing in the morning, which is basically just salt water with some greens powder. And I always move a little bit. And there were times when this was almost impossible and I didn't do much but sit outside and do slow breath work. But now I can walk most days. I can do Pilates a few times a week. And that movement helps me to live into my vision, which I've always viewed myself, and I appreciate my identity as like an athlete. And that's a part of my identity that I don't want to entirely give up really ever. So even though I might be doing beginner home reformer Pilates, it puts me back in that mindset of who I am. And it's really my nutrition. I don't drink alcohol, prioritize a high protein, high vegetable, high polyphenol food plan, especially in the morning. And I do eat less now. My body doesn't tolerate large amounts of food, and I stop eating earlier, especially in the winter, because that piece is so important to me. So those are the key things that I think are very accessible. And the other thing is that I do have lovely community of friends, and I do prioritize like just going out and hanging out with them, every couple weeks we get together and go to a happy hour or something. And whatever it is, I just go for the chatting. And I think that's so important. You have to have like your just your friends, and to not be talking about this. I talk about this a lot at work because I think it's important.
Yeah.
Yeah. But at home, you know, we chat about like what our kids are up to and
Books
all
you're
the
reading.
things. Yeah. Books.
Yeah.
Trips, you know.
We could be
stuff like
besties,
that.
honestly, Jessica, because all of the things that you'd said are all the things that I do every day, except that I am lights off at 10 p.m. So
Yeah. Same. I mean, I usually read in bed for a bit.
Yeah.
So, yeah.
I think that these are all doable and manageable. I know that there's a lot of other things that you have done, and I think I love these non-negotiables. I think these are profound. I know I had a really awesome date with friends tomorrow, but obviously my sister is more important than that friendship date.
Yeah, sure.
But I was really bummed. I was like, oh, it's my girls. I wanted to see them. And obviously we've been voice memoing back and forth. But yeah, I mean, those are I think community. I think this time can feel, especially when we're not feeling great or feeling our best, it can feel really isolating.
Yeah.
And I think that's the one thing when, you know, especially when women are struggling with mental health issues or lack of emotional resilience in this transition, that having our friends, people who you feel safe with, that you can just be your full self with, I think is really, really critical.
Absolutely. And I would say that I really believe, and I know this is going to be a little controversial, for your own sake, use your COVID mitigation strategies. It doesn't mean you can't live your life, you can't go anywhere, but N95 masks do help. None of these tools are perfect solutions, but N95 mask in crowded places, indoors, meet with your friends outside as much as you can, which is also good for you in general. There are nasal sprays and mouthwashes and eye drops and things like that that mitigate COVID viral load in that initial exposure. Those things, and as we optimize our immune resilience, we can hopefully shift into that subcategory of people who do seem to have an easier time. But COVID mitigation strategies are not perfect, but they do help. Ventilation, air cleaning. Again, why do we want to live in dirty air anyway? Like, have an air doctor in your house, you know, if you're going to invite people over. Yeah.
Yeah. Well, we, again, the mold that we had, like we stepped it up. We have a mold, we have a crazy filter on our HVAC, the whole thing, everything.
Yeah.
Yeah. So yeah, we
and
have,
so,
yeah, multiple,
you know, it's unpopular to wear a mask, but it really does help. And if you want to preserve your brain, probably in the next 5 years, that's one of the most valuable strategies you can use. And I hate it because it's so political and it is annoying. Like, I hate wearing masks as much as the next person, but the data on N95 masks is clear. Again, I don't think you have to do it all the time. I think you can meet with people outdoors, but if you're on an airplane, public transportation, at a big concert, you know, my daughter does theater. If we go to one of her plays, if you go to a hospital, you know, those are some higher risk times that it will protect. That's probably one of the strongest things you can do. Don't buy 100 supplements for, you know, nootropics. Just protect your brain.
Thank you. Thank you. Thank you. This is so profound and so powerful. I know this is not being talked about enough. And I'm just so grateful to have you as a friend and someone who can come on and just shed light on this, especially at a time where we have heightened, you know, in California, at the very least, we have heightened numbers. Yeah. And women are struggling, you know, but like, it's just one more thing to throw in there that are not making things easy.
You know, I mean, if there's another thing, you'll just find me either on a farm in Vermont or some private island. If anyone who wants to come and join me, we'll just stay in our own little bungalows and then we'll meet for chit-chatting.
Yeah, because she's getting older. You know, your daughter is getting older. Like, that's becoming more and more of a reality. I understand that.
I mean, I think we all probably feel this way at one point, right? You're like, oh my gosh, how many more things can we take? But the good news is that perimenopause is also an age and stage. And one thing that I've been lucky enough, I have a lot of longevity in my family, and I have known many of my grandmothers and great grandmothers well into their 90s, you know, since I was 13 all the way until I was in my late 40s. I've had grandparents and great grandparents to talk to, and every older person, patients, family members that I've ever met who lived into their 90s, they all told me that the 60s and 70s were the best years of their lives.
I love it. My grandmothers are still alive. So
Nice.
I love that. Yeah. And they're in their, well, one's in their 90s, one's in their 80s. But yeah, it's really cool.
Yeah. See what they say about that.
Yeah, I'm curious. Yeah, I'd be curious. And I do know that this is, I mean, I think that this is, like you said, it's a moment of agency. It's also a tipping point, you know, we're called to the occasion to really you know, like you said, have those non-negotiables. Maybe we didn't
Yeah.
have to have them earlier in our life. And now all of a sudden we're being called to, I always say we're being called to tend to ourselves in a very, you know, in a way that's really meant for us. And I am all for that. Like I will fully own that journey. You know, it's time for us to really take care of us, like our own individual selves. And then the result of that is we can continue to take care of everyone we're supposed to be taken care of.
For sure. I mean, I think that's so key to know more and more about what you want, actually take care of the things you want to take care of. It gives you the energy to be able to take care of others in your family in a healthy, boundaried way.
Exactly. I call this my Queen of Hearts era. Like it is just boundaries. You know, it's just like no one's crossing those. So they're pretty fierce. Again, for me to optimize and then show up, you know. And so I think this is the time where we get to really set that.
Absolutely.
Well, thank you, honey.
Thank you so much.